Good evening, friends. My name is Nikita Bode, and in today's video, we are going to discuss about the anticoagulants. Before jumping on anticoagulants, we should know about the coagulants. What are the coagulants? Coagulants are the factors which are present in the blood. They used to clot the blood. Means when any vein or any vessel get ruptured and blood starting flowing outside, then that factor started stimulated, and then they form the coagulation at that point where the vessel is get ruptured. When the vessel is get ruptured, and after that they block that ruptured vessel to uh, to stop the excess flow of blood from that particular vessel. These are the coagulants, and coagulants are but after that the anticoagulants plays a different role, exactly opposite role of the coagulants. Means that if the coagulants are uh, coagulate the blood to stop the flow of blood, outflow of blood from the vessels outside, then the anticoagulant form the clot to stop the flow of blood. Anticoagulants does not stop. Means when any clot is occur in a vessel, or when after the consumption of coagulants drug, it get dissolved and the flow of blood get regular, means continuous. Anticoagulants, these drugs are used to reduce the coagulability of the blood. Means it stops the blood from the coagulating. Usually it is also known as a blood thinner. Blood thinner means it thins the blood. It thins the blood to continue the flow of a blood. The drug which inhibit the clotting by the blood thinning. These are the blood thinning. Means coagulants, anticoagulants. Coagulants are the family of medication that stop your blood from the clotting too easily. Anticoagulants stops the blood from clotting. Means they does they If the blood is clotted, then it play the role of a barrier to the flow of a blood. Anticoagulants, they break down existing clots to prevent the clot from forming the first place. Means when the any clot is formed in a blood vessel, the anticoagulants break that clot and started the blood flow regularly. These medications can be helped to stop life-threatening conditions like strokes, heart attacks, and pulmonary inflammation, all which can happen by the blood clots. Means that the blood, after the clotting of blood, there are many diseases occurs. Means brain stroke is there. After that, like heart stroke, heart attack. After that, pulmonary disease are occurs by the clotting of blood in a vessel or the vein. What is a coagulant? Anticoagulants are the group of medication that decrease your blood's ability to clot. Anticoagulants are a group of medication. Means it is a medication group which decrease the chances of clotting of blood in your veins or in your body. Uh, After that, they do that by letting your body break down existing clot, or by preventing down clot from the forming. Anticoagulants comes in a many different forms, including injection, intravenous drug, and the medication you take by the mouth. They often threat the prevent life-threatening condition that can be happen because of blood cells or blood clots that stroke, heart attacks and pulmonary establishment. After that, the mode of action of anticoagulants. There are two mode of action. Firstly, the by inhibiting the action of coagulating factor. After that, they interfere in the synthesis of coagulation factor. After that, the classification. The classification of coagulants are divided into two parts. Firstly, used in vivo and in vitro. After that, in vivo is also divided into two parts, that is parental and oral. After that, in vitro is also divided into two parts, that is heparin and calcium complexing agent. Firstly, we see the oral route of administration. These all these types are classified by the route of administration. The first is oral. It occurs by the vitamin K inhibitors. That is vitamin K is a calcium. It is a clotting factor of blood. The main example of it is a warfarin and a dicombinol. After that, factor Xa inhibitor. The example is rivaroxaban and abiprubart. Third one is a direct thrombin inhibitor. The example is digivoxtran. After that, the parental route. The parental route is also divided in two subtypes. There are indirect thrombin inhibitor and indirect thrombin inhibitor. The indirect thrombin inhibitor contains the infiltrated, that is a heparin, and LMW, that is low molecular weight. The example is enoparin and diazoparin. After that, the fundaparamento, that is a intraparentex. After that, the second type is direct thrombin inhibitor, that is a type in herodin and lipotin. This is the basic information about the coagulants. Basically, the coagulants are the blood thinning agent, which are coagulants which are breaks the clots breaks the clot in a way, breaks the clot to continue the flow of blood from which are present in a blood vessels or a vein. Anticoagulants are the medication. It's a blood thinning, means it thins our blood. Anticoagulants are the group of medication that decrease your blood's ability to clot the blood. They do not buy. Anticoagulants are available in a various doses. That means oral consumption, IV, intravenous, and injection, serums. After that, the capsules, tablets. In a serious or critical condition, there is a in means intravenous is a fast route, means after the coagulation anticoagulants are injected in the body, they shows a rapid effect as compared to the consumption of tablets. In critical condition, there are given the anticoagulants by intravenously, not by the orally. And in non-severe conditions, the anticoagulants are given in a tablet form or the capsule form. If any clot is occurs in our brain vessel or the brain hem, then the chances of paralysis and the chances of heart attack are increases. That's why the anticoagulants are given to thin the blood and to break down that clot. That's it. In that video we all cover that we cover almost all topics of anticoagulants. In that we studied the definition of anticoagulants, mode of action of coagulants, the basic information about coagulants, classification of coagulants with the example. That's it. Thank you so much.